Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the hand. It is the Scaphoid shift test, or the Watson test. So this test came from a paper back in 1986 by Dr. Kirk Watson. And in this paper, he was describing rotational instability of the scaphoid and saying that if there's too much rotational instability, it can lead to degenerative changes that go on. And he describes this test in the paper as a way to classify what type of instability that the person has, and so from that to therefore go about a treatment plan for it. So it's either conservative all the way to like surgery. So here is how you do it. To perform this test, you have the person, you can have them sitting across from you like this, hard surface, so they can support their elbow. Now, Dr. Watson describes doing this test of using the same hand as the patient. Then you want to reach around, so your fingers are kind of behind the wrist there, with the thumb on the scaphoid. You passively take the wrist from an ulnar deviation to a radial. And if it's normal, you should feel the scaphoid kind of pop into your thumb. But he says if it's a tear or a laxity, it should shift dorsally, shift back. He also describes that scaphoid becomes more in line with the forearm when it's ulnar and more perpendicular with that radial deviation. Now, the more current descriptions of performing this test add a little bit additional movement to it. So same position through here, thumb there, but you take them into ulnar deviation and some extension. Then you take them into radial deviation and some flexion. And again, you should feel that scaphoid pop into your thumb. But if there's laxity or a tear, your pressure of your thumb will cause it to shift backwards. So as you get into that position and then you remove your thumb, the scaphoid will reposition, so it'll clunk back into it. So if it's bad, it'll go right back into it, and it is painful. So that is how you perform the Scaphoid shift test. In getting into the research on this test, there is some out there. Now, there is a big jump. There was some done in the 90s, and then it kind of jumped into the 2000s, and then there was some here just a few years ago. But the one recent one I found, they were looking at the diagnostic accuracy of this test, and they found that with a lower grade scapholunate ligament laxity or injury, it's not quite as sensitive or specific, somewhere like the 50%. But if it goes to the larger ones, it is a little bit more diagnostically accurate. They're also saying there's kind of an issue with it if the person has a lot of like natural laxity, that you can get some false positives. There was another research study done, and they were looking at doing this test along with diagnostic ultrasound. And they found when they used the ultrasound and this test that it was very reliable. Now, going back to that first study I talked about, they did say it is a good test to have in your assessment toolbox, so you can utilize this test. But if it's negative and you're still suspecting it, to do further investigative diagnostic tools or methodologies to determine on what's going on. So anyway, that is the Scaphoid shift or the Watson test. Let us know, what do you think about it? Do you use it? Do you like it? Let us know down in the comments. And as Mateo always says, take care of yourself, take care of your patients. We'll see you next time.